Today we will discuss about the how to identify the structure inside the lower limb. First of all, this is the right lower limb. This is the great toe. It lies on the medial aspect. This is the medial border of the lower limb, and this is the lateral border of the lower limb or lateral side. So first of all, you have to identify medial border. It is also called the preaxial border, and lateral border it is called the postaxial border. You have to put the lower limb into the front side. So this is the front of the thigh. First of all, you just keep this is the front of the thigh. This one is the front of the leg. Here this is the extensor compartment, and this is the front of the thigh. First of all, we will discuss about the structure inside the front of the thigh. This is the muscles which is coming from the anterior iliac spine to the medial surface of the tibia, upper part of the medial surface of the tibia. It is the Sartorius muscles. I will keep it on side. If it is on the side, you have to first verify where it is lower attachment. In body you will not see the upper attachment because of the we already separated the lower limb. After that, you have to concentrate over the patella and the muscles which is straight muscles and which is goes to the patella. It is the rectus femoris. This is the medial border. You have to remember this is the medial border, and this muscles which is triangular in shape, it is the vastus medialis. Lateral to the rectus femoris, this muscles it is called the vastus lateralis. Below to the rectus femoris, the muscle it is called the vastus intermedialis. It is also called the four muscles together, that's why it is called the quadriceps femoris. And this muscle it is the chief extensor of the knee joint. Also rectus femoris, which is helpful for the flexion of the hip joints. All these muscles which is supplied by the femoral nerve. So the sartorius which is supplied by the anterior division of the femoral nerve, and femoral nerve which is formed by the dorsal division of the ventral rami of the L2, L3, L4. If it is it is supplied by all these muscles, sartorius, vastus medialis, rectus femoris, and vastus lateralis, and vastus intermedialis. All this supplied by the femoral nerve. Only sartorius which is supplied by the anterior division. Remaining are supplied by the posterior division of the femoral nerve. After that, you have to see that here already this is the medial side, and you just follow the medial side, and you can see there is a just medial to this femoral vessels. Whenever there is a limb which is detached, you can see there is a femoral vessels. This is the femoral vein, and this is the femoral artery. So these are the two structure, and along with its lateral to its there is a femoral nerve. Here there is a we have not, you cannot see in here, but this is a femoral. These are the branches of the femoral nerve. This is a branches of the femoral nerve, and medial to its there is a one muscles. It is a adductor compartment, and this is called the medial compartment of the thigh. It is the adductor longus. After that there is a adductor brevis. This is the adductor brevis, and this is the adductor magnus. Another muscles it is which is the gracilis. You can see this is the gracilis muscles. So these are the muscles you can see on the medial aspect. Here you cannot see the obturator externus because we already detached the lower limb from the hip joints. That's why we already cut the obturator externus. So here you can see just medial to these femoral vessels there is a vastus. This is the adductor longus, adductor brevis, and adductor magnus, and another muscles, it is the Gracilis muscles. All these muscles which is innervated by the obturator now, it is also formed by the L2, L3, L4 division, and it is a ventral division of the L2, L3, L4. If it is dorsal division, then it is the femoral now. So this is the medial compartment. Here you can see. Now I will show you on the lateral aspect. There is no muscles over the lateral aspect of the thigh, but here you can see there is one muscles which is inserted inside the iliotibial tract. This muscles, it is a very small muscle anteriorly. It is the tensor fascia lata. And another muscles, it is inserted inside the iliotibial tract. It is the gluteus maximus. So two muscles which is inserted inside the iliotibial tract, tensor fascia lata and the gluteus maximus. Gluteus maximus also inserted over the femur on the gluteal tuberosity, but 75% of the fibers which is inserted over the iliotibial tract. Now I rotated the limb on the posterior aspect. Here you can see this is the small toes or little toes. This side it is called the lateral side. From the upper side you can also identify there is a gluteus maximus, and also on the lateral aspect there is a iliotibial tract. In the medial aspect you can see this is the posterior fiber of the adductor magnus also you can see, but now this is the back of thigh and we will discuss on the back of thigh. On the lateral aspect, posteriorly and laterally, the muscles, it is called the biceps femoris. This is the long head of biceps femoris, and this one is the short head of biceps femoris. The short head of biceps femoris, it is the only muscles which is arise from the linea aspera of the femur. Remaining all these hamstring muscle, it is called the hamstring muscles, have a common origin. These all are the hamstring. It is arise from the ischial tuberosity, and the lateral aspect it is the biceps femoris. This is the long head and short head. This is the another muscles which is look like tendon like muscles on the back of thigh on the medial aspect. It is the semitendinosus muscles. Just below to the semitendinosus there is a muscles which is bulky, and it is called the semimembranosus muscles. So these are the main muscles on the back of thigh. Lateral aspect there is a biceps. It is a biceps femoris, have a two head, long head and short head, and this is on the lateral side, and this is the medial side. Medial side you can see semitendinosus and semimembranosus, and in between there is a largest nerve or thickest nerve of the body. This thickest nerve of the body, it is the sciatic nerve. This is the sciatic nerve. Here you can see this is the sciatic nerve, and this sciatic nerve, the laterally the fiber which is goes, it is the common peroneal, and this is the tibial nerve. Always you have to see this tibial nerve which is goes on the back of the leg. Here you can see this is the tibial nerve along with the its, and this is the popliteal fossa. I will show you the boundaries of the popliteal fossa. Supero-laterally there is a biceps femoris. Supero-medially there is a semitendinosus and semimembranosus. Infero-laterally there is a lateral head of gastrocnemius, and infromedially there is a medial head of gastrocnemius. Here you can see this is the muscles which is the plantaris muscles. Here this is the signing muscles which is lies inside the plantaris, and lower one this muscles which is along with the gastrocnemius, it is the soleus muscles. It is a soleus muscles, and posteriorly here you can see there is a this is the femoral, this is the popliteal vessels. Once it enter inside the popliteal fossa, the femoral vessels continues as a popliteal vessels. Femoral vessels, the name which is changed whenever it enter through the adductor magnus, there is a hole. It is called the adductor hiatus, and from the adductor hiatus, this popliteal femoral vessels, it is inside the popliteal fossa. It is called the popliteal vessels. So this is the very thin wall, and this is the first one is the sciatic nerve. This is the sciatic nerve. It has a common peroneal and tibial part. This is the femoral vein, and this is the femoral artery. This is the popliteal vein, and this is the popliteal artery, and these are the popliteal vessels. Popliteal artery, basically inside the popliteal fossa, it gives the 5 branches. This is the superolaterally. I have not dissected, but the superolaterally, superior lateral genicular, superomedial genicular, middle genicular, infrolateral genicular, infromedial genicular, and then the popliteal artery, which is divided into the anterior-tibial artery and posterior-tibial artery. Posterior-tibial artery, which is goes along with the tibial nerve. This is the posterior-tibial artery. It is goes along with the tibial nerve, and the anterior-tibial artery, which is enter inside the anterior compartment here, along with the deep peroneal nerve. But I will show you later on. Now this is the back of the leg. Again, I will show you. This is the lateral side, this is the medial side. We already discussed. This is the lateral head of gastrocnemius, this is the medial head of gastrocnemius, this is the plantaris, and along with it, this is the muscles. It is the soleus muscles. So it is called all these 4 muscles, it is called the tendo Achilles. This is we have caught the tendo Achilles, and it is inserted on the posterior side of the calcaneum. This is the back muscles, and also another back muscles deep to it. Here the structure passing back of leg to the sole of foot. These are the muscles. The first muscle, it is the tibialis posterior. This is the tibialis posterior, and then if it is sole is dissected, then so this is the deep muscles of the leg. Here you can see this is the first muscle we already discussed. This is the tibialis posterior. Here you can see this is the tendon which goes to the great toe. It is the flexor, hallucis, longus, and another tendon which goes inside all these 4 toes. This is the tendon which goes inside all 4 toes. Here I have cut this tendon. Here you can see this tendon. It is the flexor digitorum longus. So these are the 3 muscles: tibialis posterior, flexor hallucis longus, and flexor digitorum longus. Along with it, there is a tibial nerve. This is the tibial nerve, and inside the sole of foot, it divides into the medial plantar nerve and lateral plantar nerve. Same way, the posterior tibial artery also divide into the lateral plantar artery on the lateral aspect and medial plantar artery on the medial sides. So these are the structure you can see on the back of leg. Again, I came to the front of the leg. It is called the extensor compartment. Talented husbands are never dear person. You have to remember, this is most anteriorly, just medial to the muscles which goes to the great toe. This first muscle, it is the tibialis anterior, extensor hallucis longus. This is the talented husbands. R means artery, anteriotibial artery. Here you can see this is the anteriotibial artery, and then there is a deep peroneal nerve, then extensor digitorum longus, and then peroneus tertius. So this is the peroneus tertius. In some of the body there is a absence of the peroneus tertius. Below to these muscles, here you can see there is a one more muscles here, my forceps, which is under beneath to it. This is the there is a single sleeve, but it divided into the 2 parts. This sleeve which goes to the medial 4 toes, one which goes to the great toe, it is called the extensor hallucis brevis, and remaining 3 slips which is goes to the second, third and fourth toes, it is the extensor digitorum brevis. So here there is a 2 muscles. This is the extensor hallucis brevis and extensor digitorum brevis, but mainly extensor compartment, it contains the first muscle, it is the tibialis anterior. This is the tibialis anterior. This is the extensor hallucis longus. Here there is a we have not clearly seen the antitibial artery, but this is the deep peroneal nerve, and then extensor digitorum longus, and then peroneus tertius. And deep to it, we already discussed, there is a 2 small muscles. It is the extensor hallucis brevis and extensor digitorum brevis. All these muscles of the front of the leg, which is supplied by the deep peroneal nerve, it is a branch of the common peroneal nerve. And the common peroneal, again, it is a branch of the sciatic nerve. So this is the extensor compartment. And just on the lateral aspect, only there is a 2 muscles. Here you can see there is a 2 muscles on the lateral aspect. This is the, you have to remember, first of all you have to identify the little toes. This is the lateral side, and then the lateral malleolus, and this is the peroneus longus and peroneus brevis, and both the muscles which is innervated by the superficial peroneal nerve, it is a branch of the common peroneal nerve. So on the back side, simply you have to remember back side, all these muscles, back of thigh, back of leg, all these muscles which is innervated by the tibial part of the sciatic nerve, except you have to remember there is a short head of the biceps, which is supplied by the common peroneal nerve. And we already discussed there is a front of the thigh nerve supply, it is a femoral nerve. Medial aspect of the thigh, it is called the adductor compartment, it is supplied by the obturator nerve. Back of the thigh and back of the leg, all these muscles which is innervated by the tibial part of the sciatic nerve. This is the tibial part of the sciatic nerve, here you can see, and also here you can see this is the tibial part of sciatic nerve. And all the muscles in front of the leg, it is the extensor compartment which is supplied by the deep peroneal nerve, and the lateral compartment which is supplied by the superficial peroneal nerve. Here we have not discussed the gluteal region, but inside the gluteal region you have to remember there are 3 gluteal muscles. I will not able to right now to show you the gluteal muscles, but this is a gluteus maximus. Deep to it there is a gluteus medius and minimus, and also there are lateral rotator like the 2 superior gemini, inferior gemini, along with it obturator internus, piriformis. All these are the lateral rotator of the thigh. And the gluteus maximus, it is the chief extensor muscles, while the gluteus medius and minimus are the chief abductor of the thigh. So hope you enjoy the revision of the lower limb. I will not discuss here the sole of foot, but the sole of foot, it contains the 4 layers. The first layer, there are 2 abductor muscles here. This is not dissected part, but I will show you if it is possible. Here you can see this is a plantar aponeurosis we have removed. After that, on the medial aspect, there is a first layer, it contains the abductor hallucis. This is the abductor hallucis. And on the lateral aspect, there is a abductor digiti minimi. And the medially, flexor digitorum brevis, the fiber of the flexor digitorum brevis. The second layers, which is contains the 2 extrinsic muscles, which is coming from the back of leg to the sole of foot, are the flexor hallucis longus and flexor digitorum longus. This is the flexor hallucis longus, and lower one, it is the flexor digitorum. This is the flexor digitorum longus, below to the flexor digitorum brevis. And inside the flexor digitorum longus there are muscles which is lumbricals, 4 lumbricals you can see. So this is the second layer. Into the third layer you can see there is a deep to the abductor hallucis. Here there is a flexor hallucis brevis. You have to remember this is a flexor hallucis longus, but deep to this abductor hallucis and flexor hallucis longus there is a flexor hallucis brevis. This is a flexor hallucis brevis, and deep to this we have not dissected here, but here I already put up all the videos of the sole of foot. You can see there is a layer of the sole of muscles of the sole of foot. It is a adductor hallucis also you can see, and the flexor digiti minimi. And the fourth layer you can see there is a medial to laterally there is a tibialis posterior, and lateral to medial there is a peroneus longus along with its dorsal and plantar introsei muscles. So hope you enjoy the revision of the lower limb, and thank you very much.